Get off! Oh, get off me! Oh.
I thought you said my results would definitely be in today. Oh. Well, why aren't they?
Is everyone here, Vivian?
All except Dr. Bell.
Yeah, results in 2 days guaranteed, that's what I was told. Yeah, that was 10 days ago. The whole point of going private was to avoid this kind of delay. Yes, well, it would have been faster on the NHS. Oh, yeah, whatever.
Everything all right?
Yeah. Yeah, just a patient waiting for results. I stupidly told her it'd be faster if she went private. And all she's getting is excuses from those idiots, so...
Typical. Maybe.
What happened?
Some thug just ran up and attacked her, right out of the blue.
Are you okay?
Yeah.
He was trying to get her handbag.
Have you got any pain anywhere?
No.
He must have seen her drop it.
Did you hit your head?
No, I don't think so.
He was probably on drugs. Oh, you're not safe anywhere anymore.
I think I'm all right, really.
Have you called the police?
No, please, I don't want the police.
But what if he comes back?
It was a girl
What?
who attacked me, and I don't think she will come back. She looked more frightened than I was.
I'm not surprised, the way you hung on to your bag.
It's got my insulin in it.
You're diabetic.
Yeah.
And the way you walloped her with the rubbish. I bet she didn't expect that.
You should report it.
No, I'd rather not. It's probably just a mixed-up kid.
Even so.
Look, I've just moved in here. It's my first chance at living on my own. I'd rather not make a fuss.
Let's get you back in the chair. Come on.
Well, the campus surgery is a mess, and all the equipment's outdated, and I can't tell you the number of doctors and locums and agency nurses that have been in and out of there.
That sounds good.
It's a challenge, Dr. Clay.
Exactly. Which is why I've allocated you all individual areas here, okay? Now, Nick and Vivian, could you give me an overall look at logistics, please?
Sure.
George, could you give me some ideas on how complementary medicine can be especially geared to students? And, oh, Jimmy, like some input on sports clinics?
Okay.
Right. Could you bring her up to speed when she gets in, please?
I can certainly try.
Michelle, have a quick rundown of local practitioners, you know, who's available, who might be interested. And Archie, could you give me a profile on the university, please?
Anything I can help with?
I'll let you know. Now, listen, try and get as much down as you can on paper, okay? I mean, don't worry about details. Bullet points will do. You know, the more creatively that we can adapt our proposal to the needs of the university, the better our chances are going to be.
Is there a deadline?
We've got to register our interest by tomorrow.
Tomorrow?
Well, yeah, don't panic. It's not the deadline for the final pitch. You've got plenty of time for that. But nevertheless, the sooner we get started, the better. Now, let's have some real blue sky thinking here, people, okay? Imagination. All right, come on, let's get cracking.
Well, you seem to be all in one piece, just a little bit shaken up maybe. That's to be expected. If you've got any worries, just call your GP.
I haven't got a GP yet. That's another thing I haven't done.
Well, you can always register at the mill if you need to.
Oh, could I?
Sure.
Tanya?
Oh, Lewis, I'm so glad to see you.
Are you all right?
She was attacked.
What?
I saw the whole thing. This hoodie came out of nowhere.
Please, it's okay.
Well, are you hurt?
No, I'm fine.
We should get you to hospital, get you checked.
Oh, it's all right. I've had a quick look at her and it's just a few minor cuts and bruises. It's nothing to worry about.
And you are?
She's a doctor, Dr. Bell.
Yeah.
Right.
I was just passing. Anyway, I'd better get on because I'm running a bit late, but call me if you need anything, okay?
Thank you.
I have a bad feeling about this neighbourhood.
Normally it's so quiet around here, you wish something would happen.
Really?
I wonder if it was drugs.
What?
Oh, you know they're all on them these days.
You sure you're going to be all right living on your own in a place like this?
I thought I would be.
If she needs someone to look after her, I'm just next door. I'd be only too happy.
Don't want to be looked after. That was the whole point.
We'll sort something out. Let's get you inside.
I have to clean this up.
Oh, I'll do it.
It's my mess.
I don't mind, really.
I want to do it.
It'll give me something to do.
I said no.
Come on. We'll do it later.
Shouldn't have snapped at her.
You're upset.
It's not very neighbourly.
I'm sure she'll understand.
Yeah, well, it's hardly a great start, is it?
Now, where do you want this? Over here, I think.
Yeah, that's fine.
Well, this was never going to be easy for you.
Well, I know, but I didn't expect this.
Well, I can always stay on here until you feel more comfortable.
I thought I was ready.
Well, maybe you're not. Maybe it's too early. You don't want to push yourself.
If I don't push myself, I'll never feel ready. I can't keep relying on you, Lewis.
I like it when you rely on me.
I know. But it becomes a habit and I start to think I'm incapable.
Well, you have to be patient.
Anyway, how did the interview go? Lewis. You didn't go, did you? I thought you were back early. Oh, Lewis!
What's the point? I haven't got any experience, haven't had a job in years.
I'm sorry, looking after Aunt Dorothy for 6 years was a job. And I don't know what I'd have done after the accident if it hadn't been for you. What's this?
It's the key.
Why do I want this?
I don't know, they came with the cabin.
Stop avoiding the issue.
I'm not.
Yes, you are. I really wanted you to get that job. Why don't you ring them up, see if they'll give you another appointment?
It's probably too late.
You don't know till you try. Please. For me.
All right.
Oh. Well, there's a first. Me telling you what to do.
What did I miss?
What?
The meeting. Julie's plans to invade Poland.
Oh, not much. It's a fantastic challenge. Julia wants blue sky thinking from everyone. Well, almost everyone.
Oh, blue sky thinking.
Yeah, really exciting. Big ideas, innovation. Go mad.
Daniel?
I'm just going to thank her for earlier. Hello.
How is she?
She's fine.
25 years I've lived here. I've never known anything like it before.
Can I ask you a favour?
Oh, yes, anything. But since my husband died, all I've had is time on my hands. Sometimes I think I'll go crazy in there, no one to talk to. So you just tell her if there's anything she needs, just phone me and I'll pop straight over.
That's sort of exactly what she doesn't need.
I'm sorry?
Tanya needs to do things for herself. That's what she wants. You know, until she is able to look after herself, she won't feel confident about living alone.
Oh, just trying to help.
Oh, I know, but she can get very prickly when she thinks people are interfering.
Interfering?
That's the way she sees it.
Oh, I'm sorry.
It's not your fault. Things have been very tough since the accident, and the best thing we can do is just to let her get on, okay?
Okay.
Thanks.
Can I help?
We'd like to register.
Okay. Why do you need to register?
I've decided to stay.
You have?
Just until I know you're safe. It wouldn't be right to leave you now, not after what happened this morning.
There you go. Thank you. And I'd like to see a doctor, Dr. Bell, if possible.
Okay. Oh, she's got a drop-in clinic this morning, and she's free at the moment, if you'd like to go on through. Round to the left. Last room at the end.
I think I'd like to see her on my own.
Oh, why?
It's a bit personal, Lewis.
Oh, okay. Well, give me a shout if you need anything.
I've had a lot of trouble with insomnia since the accident. Those were great at first, but lately I've gone off them. They knock me out cold. I wake up in a total daze.
Well, that's not a nice feeling, especially when you're living on your own.
Oh, I'm not really on my own. My cousin's still with me. He's helping me settle in.
All right, well, let me know how you get on once he leaves.
Oh, well, thanks.
These are actually quite strong. Do you know why your GP prescribed them in particular?
Oh, he didn't. My cousin got them for me.
Your cousin?
Yeah. He's got some mad idea they'll help me walk again.
What?
He did some research on the internet.
Right, and how does he figure that sleeping pills are going to help you walk?
Well, apparently they gave these pills to some people who'd been in a coma for years and they suddenly woke up.
But that doesn't make any sense. Why would you give sleeping pills to someone to help them wake up?
I don't know. Apparently it's true.
Oh, no, hang on a minute. I remember this. They did some tests. This was in South Africa, yeah?
Yeah.
Well, those patients were in a permanent vegetative state. It had absolutely nothing to do with paralysis. You know, these pills aren't going to miraculously cure the damage to your spine.
I know. That's not why I was taking them. Look, as long as they were helping me sleep, there didn't seem to be any harm in humouring Lewis.
Your cousin?
Yeah. He can be a bit obsessive about my health, so sometimes it's easier just to go along with him.
Well, you should never take any medication without running it past your GP first. You could do yourself some serious damage.
Actually, that's what I wanted to talk to you about. I stopped taking them about a week ago and, well, ever since then I have been feeling kind of anxious. I mean, it could just be the move.
Or you could have developed a dependency. I mean, 3 months is quite a long time.
Yeah, I've been getting the shakes too.
Okay, well, let's have a think about prescribing you something a little bit milder until we can come up with a more long-term solution for your insomnia. And in the meantime, please don't take anything prescribed by your cousin. If he's not qualified, then he's got no business giving you medical advice, however well-intentioned it is. Any problems with the new prescription, just let me know.
Thank you. I can do it, Lewis.
Okay. Everything all right?
Yeah?
Anything I should know about it?
No.
So what's this new prescription?
Oh, it's nothing.
Oh, Julia, can I have a word with you about the new surgery? Can I wait? Well, it won't take a second. When I was at uni, some of my friends were in a really bad way because of all the stress and anxiety. And one girl got so depressed that she couldn't leave her room for 6 months. And then I read about this program, CCBT, and I thought that it...
What?
CCBT. Computerized Cognitive Behavioural Therapy. It's a self-help program, but it's supervised, but done on a computer, you know, with multimedia animations, voiceovers. It's like a PS3 for depressives.
A computer game? I've given you your areas, Melody.
Yeah, but blue sky thinking.
Not now, Melody. Just write it down.
Ew. So much for the blue sky.
Sounds like a good idea to me.
Yeah, it is. Not that it matters, she wasn't listening anyway.
Well, if she doesn't appreciate it, what's the point?
I can't believe you even discussed it with her.
Why?
You only met her this morning. You don't know anything about her.
She's a doctor, Lewis.
Of course she's going to say the South Africa trials don't mean anything. She's covering her back.
I've left my handbag in the car.
I'll get it in a minute. Whether you walk again or not means nothing to that doctor. She's not going to risk her reputation for you, is she?
I don't want to talk about this here.
This. Anyway, there's no point. I stopped taking the pills over a week ago.
What? Why didn't you tell me?
Just forgot.
Do you have any idea how hard it is for me to get those pills?
No.
You can't stop now, Tanya. The pills are starting to make a difference. You said you felt something in your leg. You did, didn't you? Tanya?
No.
Then why did you say you did?
I don't know. When you get obsessed with something, it's really hard to talk to you.
So you lied to me?
I forgot to tell you, it's no big deal.
Yes, it is!
No, it isn't. Honestly, sometimes I think all this is more about you than me.
That's not fair. I'm always there when you need me.
No, you're always there whether I need you or not. Do you have any idea how hard it is for me to make this move? I have nightmares about living on my own, trapped in this chair, helpless. It'd be so easy for me just to give up and let you do everything.
Then let me.
No. If I do, I'll end up like Aunt Dorothy.
It's not the same.
Right, I may not have Alzheimer's, but I'm just as dependent on you as she was. You won't even let me undress myself when I have a bath.
I only do that because...
How do you think that makes me feel? You don't respect my space. You make all my decisions for me. You tell me what drugs to take.
I do respect
No,
you.
you don't. You're all over me, Lewis.
I've always done everything I could to help you.
I don't want you to do everything for me. As long as you're here, I'm never going to learn to manage on my own. Sometimes I wish you would just get out of my life and let me get on with it.
If that's what you want.
Is this a good time?
Actually, no.
It's just that this really is a good idea, and it's so simple. Missed appointments are a real problem with students, right?
Not just with students.
Exactly. And most of them spend practically all of their time on their mobile phones. So we save ourselves a whole lot of time and money by building a mobile relationship with them.
Building a what?
A mobile relationship with the students. You see, we get all of their numbers and put them in the computer, and then we can text them reminders about appointments and health issues and all of that sort of...
How can a computer... Look, never mind, just write it down, will you, Melody? And aren't you supposed to be doing house calls?
Oh, yeah.
Lewis, you've got my handbag in the car with you. It's got my insulin in it. I can't get into the new cabinet. The key you gave me doesn't work. When you get this message, will you please come back as quickly as you can?
Don't interfere where you're not wanted, old girl.
Please leave a message and I'll get back to you.
This is a message for Dr. Bell from Tanya Vasey. I think I'm going hyper. My cousin's gone off with my insulin and I can't get to the spare. I don't know what to do. If you get this message, could you come back, please?
Are you all right?
No.
That's it there. It's the pen. You're gonna have to do it for me.
Oh. I don't think I can. Oh.
Miss Vasey? Oh, here, let me.
Oh.
What happened?
The key to the medicine cabinet wouldn't work.
Lewis must have locked it when he was putting things away.
What would he do that for?
Force of habit, I guess. I had to lock everything away from my aunt when her Alzheimer's got bad. Sometimes he forgets I'm not her.
Well, you should have your insulin with you all the time.
I know, but I left my handbag in the car. It's a good job Elaine was here.
I wasn't sure if you wanted my help after this morning.
Yeah, I'm sorry about that.
Oh, don't be. I do come on a bit strong sometimes.
How are you feeling?
Yeah, I think I'll be all right, thank you.
Tanya? What's going on?
She couldn't get to her insulin.
I'm so sorry. I was so upset when I left I forgot to get your handbag.
Why did you lock the medicine cabinet?
What?
The medicine cabinet. Why did you lock it?
Did I?
Yeah, have you any idea how serious this could have been?
I didn't know our key wouldn't work.
But it shouldn't have been locked in the first place.
I'm sorry, what's this got to do with you?
Well, what's it got to do with you? It's her medicine.
Well, maybe it's just as well I did lock it. What if that girl had come back?
What girl?
The one who attacked you. She was obviously after drugs. You said your neighbourhood's full of drug addicts.
Did I?
How did you know it was a girl?
What?
I never told you it was a girl. Did you?
No.
So how did you know?
I just assumed. She looked like a girl.
You never saw her?
Yes, I did.
When?
Earlier, outside the bank.
think?
She wanted money from me. Obviously for drugs, that's why I remembered her. I thought, what if someone like that attacked Tanya?
So this girl that you met then came here and did exactly that.
Are you suggesting I told her to attack Tanya?
Did you?
No! I just gave her the money so that she would go away.
Or you gave her the money to scare your cousin so that she'd have second thoughts about living on her own.
No!
Lewis.
She was never supposed to hurt you.
Oh, George, appreciate you being as quick as you can with those ideas, because I think your expertise is going to give us a real edge.
It's just what I need to do.
I'll give you a hand if you want.
Oh, it's all right, I can manage.
Oh, but at least she wants your input. She hasn't asked me to do anything.
Well, if it bothers you, then say something.
Not sure there's any point.
Don't bother then.
No news then?
What?
On your patient's test results.
No.
Chances are it'll come back negative.
Yeah, well, I just want to know so I can get on with things.
Yeah, I really don't think you've got anything to worry about.
Have I know?
I couldn't bear the thought of being without you. You're the only thing I've got. I can't live without you.
What are you saying?
I love you, Tanya.
Oh, my word. Got a funny way of showing it.
All I ever wanted was to look after you, to hold you in my arms, to be with you.
You're my cousin?
I don't care.
Get away from me.
If I can't have you, I don't know what I'll do to myself. Think of all the things I've done for you, all the years of my life I've given up for you. You can't just turn your back on me. After the accident, when you wanted to kill yourself, I was there for you. You said yourself you wouldn't have got through it without me.
Yes, but I...
Well, now I need you, Tanya. Let me stay, just for a few days, please. I'll agree to anything you want. Any conditions, please.
You paid someone to scare me. I don't think I ever want to see you again.
Tanya. No.
I think you'd better leave.
A bit early in the day to be surfing for porn, isn't it? That was humour.
I'm actually putting together a patient profile for the new surgery.
All right. What proportion of mature students?
What?
At the university. Well, you'd be surprised how many older students go these days.
Really?
Yeah, and it may make a huge difference to your care provision.
Well, thanks for your help, but...
Well, I didn't mean to...
That's all right, I think I'll handle this myself. Look, I think we should just stick to the jobs that Julie asked us to do.
If you need anything, just give me a call. Yeah, anytime.
Thank you.
Are you sure you're all right?
I hope so.
Oh, you'll be fine. And if you ever do need anything...
I know, you're just next door.
I don't mean to interfere.
You're not. And you, if you ever just want to have a chat.
Oh, boy. You don't know what you're letting yourself in for.
I think I can cope.
If she comes into my office once more or rings me with some madcap idea, I mean, which part of write it down doesn't she understand?
Okay.
Julia, can I have a word?
Julia, I'm glad I've caught you. I've just had another brilliant idea.
That's wonderful, Dr. Bell. Why don't we jot down your ideas as concisely as possible and we can look at them later, all right?
I just wanted to say how much I liked what you said earlier.
Oh, thank you.
Yeah, this thing is everybody's so busy beavering away and I've got nothing to do. I do want to help if there's anything you can think of.
Well, I can't think of anything at the moment, but if I do, I'll let you know.
You shouldn't let her get to you. It's just her manner.
No, it's not.
Well, anyway, if she doesn't want you to work on the proposal, why do you care? All of this hard work, and look where it's got me.
Yeah, because I'm sick of her treating me like a second-class citizen. Okay, I might just be a locum, but I've got as much to offer as anybody else. More, actually. In some cases, a lot more.
Really?
Yes.
Well, I mean, you can always help me with my ideas.
Don't patronise me.
I'm not.
Look, if Julia can't see what's under her nose, that's her loss, not mine. And like you say, why should I care?
Hello? Yes, this is Dr. Woodson. What, have the results come through? And? Yeah. I see.
Vivian! You look well. Oh, I'm sorry, this is my brother, Pete.
Nice to meet you.
I worked at a university surgery a few years back.
Well, that can be invaluable. You've got insider knowledge.
Can't imagine you flying to Hong Kong to visit her.
Why would I need to fly there? She's only going on holiday.
Vivian, she's emigrating.
Don't be ridiculous.
Star Trek meets Diagnosis Murder. Stay with us here on BBC1 Scotland.